Okay guys, Dr. Truesdale back. We're gonna talk about something that you all know about. We've all seen signs of a horrible or a bad facelift, okay? Not that I would ever do that, but let's talk about it. So we've all seen people who have had facelifts and we just look at them and we say, something just doesn't look right here. I'm gonna break down each of the things that maybe you didn't know you were looking at, but we all have seen. So when we do a facelift, let's break down what the actual goal is. When I perform a facelift, my goal is to make people look younger and more youthful versions of themselves. Typically, we're dealing with looseness or laxity of their face and their neck. So when we see an outcome, what we should be looking for is a natural, youthful version of that person. We should be seeing very little stigmata or signs that they've had a facelift. They should not look unnatural and they should not look weird. It should be hard to see that they actually had a facelift done, and you should see that that laxity is significantly gone or taken care of. So let's start with scarring. Scarring is a result of any surgery, and even in the best hands, there is a scar. What I tell my patients is you will have a scar. My job is to actually make your scar imperceptible. I do this by hiding my incisions inside the hair, inside the ear, behind the crease of the ear, under the chin, in little nooks and crannies that basically there are natural shadows or contour changes that you can't see the scar. When we place facelift incisions and scars, I like to place them inside the hair, in the tuft here, the temporal tuft. If the facelift is not done well, it will actually cause hair loss in that area. We call that alopecia. So you can have hair loss in the temple and actually in the behind the ear. This happens when you have a facelift and the surgeon inadvertently or unfortunately, there's damage to the hair follicles. So the hair follicles live inside the skin, in the dermis. And if those are cooked with the cautery, or if the skin isn't reoriented in the right way, the hair can grow in a haphazard manner, or those follicles can be damaged, thus exposing the scar. So in an ideal world, the scars are hidden and the hairs can cover the scar in the temporal tuft. I like to place my incision inside the ear. Now for 90%, 95% of my patients, that's where I place it. So in male facelifts, right, we're moving bearded skin like mine. And when we lift the face, that skin moves north and lateral. So if there's a lot of movement, you can actually move bearded skin into the tragus. That's a no-no. That's a sign of not a good facelift, or maybe that wasn't taken into consideration. So for those reasons, if you make the incision here, you spare the hair in front of the tragus. So there's still a bridge of non-hair-bearing skin there. And it usually heals really nicely in a man. So that's something else to look for. Scarring is one of those things that are controllable and also not controllable. So even sometimes in the best of hands, patients have unfavorable scarring, but it's not about what happens in the adversity, it's about how you deal with it. So behind the ear, under the chin, around the temple, you really should be using very meticulous technique with no tension so that the scars have the best chance of looking as good as possible, avoiding keloiding or track marks, little vertical or horizontal lines in the incision. That's a sign of too much tension along the incision line. Scars that are wide or hypertrophic or atrophic are all signs that too much pull is happening on the skin level. In fact, this is the reason why I like to perform a deep plane face and neck lift, which avoids putting any tension on the skin whatsoever. In fact, I would rather leave behind extra skin than remove too much, because in reality, the full force and the lifting that's happening is actually happening on the muscle, not on the skin. Too much skin tension will cause an unnatural look and bad scarring. Along those lines, let's talk about the other thing that just, when you look at it, you're like, this is not a good facelift. And that's a really pulled or stretched look. typically is happening when the surgeon is using, an inferior technique or making decisions about how much to pull and doing too much. Older type of facelift techniques are more prone to this, in my opinion, such as a SMAS facelift or skin-only facelift. Those are areas where there's not a full release of the ligaments that are holding the face down. There's not a full release of that muscle layer so that you can, in a tension-free manner, reposition the facial tissues with no tension. When too much tension is placed, there's a natural force that wants to spring the tissue back down. And if that isn't released, that pull will actually translate to the skin and lead to a wide or an unsightly scar, as well as a pulled, stretched look. Older facelift techniques, such as skin-only facelift technique or SMAS facelift, can also make the patient look stretched because it flattens the face out, and instead of a more natural vertical type of lift, you're getting more of a horizontal lift, which displaces the facial musculature this way rather than back to where it used to be, which was vertical and to the side. In reality, if we think about an X and a Y axis, the best orientation of a facelift is somewhere in between there. We don't want fully horizontal, and we don't want fully vertical. We want somewhere in between. And that's where the artistry and the very nuanced approach comes into play, because each face requires a little bit of a different vector. Now, the other important situation in terms of vectoring with facelifts is the vector of the skin and the muscle. Sometimes you'll see something like a Joker look. This is another sign of a horrible facelift because the skin is being pulled in one direction and the muscle is being pulled in another. This ends up looking like a swoop. So you'll see this in certain people, and the lower part of their face will be pulling this way and the upper part of the face is going down, and the interface between those two directions is leading to a pleat or a line. It looks completely unnatural, and it is not the way our face ages. And it's really just comes down to a misunderstanding of how the face ages and how to appropriately rebalance the facial harmony and tissues. So that's another sign of poor facelift technique. Another thing that can happen with a poor facelift or a botched facelift is irregularities under the skin and the soft tissue. This can lead to bumps, dents, irregularities, things that don't go away. Now, I counsel every patient in the first 3 to 6 months after a facelift, there will be a little lumpy, bumpy, usually around the side of the face, because that's the part of the face that's been lifted, undermined, whereas this part of the face is under the muscle layer, and so there's less swelling there. That differential between the skin that's been lifted up, like a carpet that needs to go back down, basically that carpet needs to then re-adhere back to the understructure, and until it does, it's going to be a little bit more swollen. But when a facelift is not done the right way, that never goes away. That can be because the surgeon basically rotates and pulls the facial muscles over it, or what we call plication. When the plication is not done the right way, that leads to thickening on the side of the face. So when I do a facelift, I'm making sure that under the skin, the contours and the alignment between the different levels and heights of the understructure have to be smooth, has to be contoured, right? It has to be really beautifully seamless underneath. Because if you don't, if you leave one part that's high and one part that's low and one part that's dipped, it's going to translate onto the surface of the skin. It's just going to look lumpy, bumpy, and not pretty. We just want something pretty. So all we want is beautiful facelift, beautiful surgery. The other thing that can happen when a facelift is done is you can have nerve injury or muscular injury, which leads to facial paralysis or signs that the face is not moving naturally, AKA smile block. Smile block happens when facial muscles are disrupted or the attachments are not reattached when the face itself has been lifted. This can happen and basically translate as a dent or something that's just not quite moving the right way after surgery, either from a nervous injury where the nerves that plug into the muscles have been cut or stunned, or the muscle itself is cut, stunned, or doesn't have the appropriate forces acting upon it. Whenever we're thinking about muscles, moving an arm, we think about a fulcrum. We think about an attachment of something to something else, and then a contraction happens. In the face, there's nothing different. The muscles attach to the bones and then attach to another structure, such as the skin or the corner of the mouth. The medialis is basically where all the facial muscles meet here in the corner of the mouth. And so if there's a blockage between that apparatus of muscle to bone to medialis or other skin, then what will happen is there will be a blockage and it won't be able to contract properly. And that will cause little indentations, irregularities, or dimples that are not cute dimples, but ugly, unsightful dimples. Something to look out for when you're looking for a bad facelift technique. Other things that can happen with bad facelift technique or consequences are telangiectasias. Telangiectasias or excessive blood vessels or reddiness are a sign that the skin itself has been damaged, meaning the skin supply, the blood supply to the skin is very haphazard. When we do facelift, especially more modern type of facelift techniques like a preservation facelift or a deep plane face and neck lift or extended face and neck lifts, we're trying to keep the muscle layer attached to the skin as much as possible to not delaminate the skin. If the skin is undermined and delaminated too much, what will happen is it will not have blood supply out where it's been lifted, furthest away from the point that it's still attached. So what ends up happening there is the skin can get very thin because the blood supply isn't there. So the skin will thin out because it can't survive. When it thins out, the other thing that you can see is a glossy, almost waxy type appearance in the skin. We've all seen this. And the other thing that can happen are little telangiectasias, spidery blood vessels, little tiny blood vessels that form these little patterns, arborizing out because the skin is saying, I need blood. And when it says I need blood, it says release more blood vessels. And as it releases more blood vessels, it's not the normal type of blood vessels that form. It's spidery little telangiectasias. And that reads almost like a vascular blush, and the skin can look kind of ruddy and more red. Also not a good sign of a facelift. To continue, inappropriate forces or vectoring in a facelift can make things look bad, such as pleating. Typically, we'll see this behind the ear. If the skin is not redistributed in the proper way, what will happen is you'll form dog ears or bumps where there's one area that's a little bit of a pleat. If too much skin is laid down in one area, it can't lay down flat. And so it requires special plastic surgery techniques to redistribute and basically make the standing cutaneous cone, or dog ear as we call it in plastic surgery, level and flat. So surgeons have difficulty with this when they're taking neck skin and lifting it up behind the ear. It ends up creating pleats, and so you can get little lines that form there. So pleats behind the ear, really not pretty, really requires that the incision is carried a little bit longer. And in a facelift, as we work our way around the ear, the skin that we're removing typically is a little bit longer than the skin that we're laying down, right? And we're meeting. So to make them more similar, to basically have them line up, the incision has to be carried a little bit longer so that the skin that wants to bunch up has more distance to basically redistribute. And it's really like a puzzle piece. So make sure your surgeon's good at doing puzzles. The other piece that can happen, in particular at the earlobe, is a pixie ear deformity. Pixie ear deformity. It is a telltale sign of a bad facelift or too much attention being placed on a facelift, and it is the bane of any plastic surgeon's existence. What happens with the pixie ear deformity is there's too much attention being pulled down, and it lengthens and inferiorly displaces the ear, and it almost makes the earlobe look like it's stuck on. Now, this is more common in some people who have attached earlobes. There are two different types of earlobe, and one is a detached earlobe, like mine. There's a very clear swoop that comes down. Some people, like this one, has a attached earlobe. Now, when the earlobe is attached like this, it's very, very important to not cause any extra pull, because if it does, you'll end up looking like you're in Lord of the Rings. And if you see a patient who looks like they're a little too swept, and a little bit too tight, and they look like they just came back from central casting for Lord of the Rings, that's a pixie ear deformity. Other things that can happen with an unfortunate facelift. Well, all of the other ancillary things that go along with facelifting. Typically, inappropriate fat transfer, inappropriate pull down at the cheek, bunching at the cheek, flattening of the commissure, inappropriate flattening of the pre-gel sulcus or the nasolabial fold where it becomes too flat, or if you don't notice any difference there at all. All of these things are signs of a poorly done facelift. And the most important thing is to choose a surgeon with a lot of experience who consistently produces beautiful work where you say, I'm going to be safe in this person's hands. Now, what if you have been botched? What if you have had a facelift that isn't quite favorable? Start with having a discussion with your surgeon if you feel comfortable with that person, right? Surgeons, we are not perfect, and so it really does require that really good relationship between patient and surgeon. And so if you're looking at yourself and you're saying there's something that's just like a little off, maybe that surgeon can correct that action. I would love the ability to try to fix something that I think I can make a little bit better. But if you feel like you don't have confidence in that surgeon and you feel like, listen, maybe this is beyond the scope of what this surgeon can do, they don't do a lot of revision facelift, I would look to people in your area, right? Look at people maybe outside your area, like Dr. Truesdale. I do a lot of revision facelifts. I do between 3 and 6 facelifts a week, every week. And so it's really important that you get those reps in, because each time you do a facelift, you learn a little bit. And it really takes a couple hundred to get under your belt before you're really quite expert. And there are very few people who are so high volume and are so nuanced and technically able to achieve those results that they can deal with complications. Because anytime we do surgery, the second surgery or revision surgery is always more challenging. More scar tissue, worries about blood supply, worries about anatomy that is different. And now you have to identify nerves and blood vessels that aren't where they originally found. And so you don't want to maim someone. You don't want to take someone who's already had a bad experience and put them in a situation that's even worse. So if you've had a bad facelift, if you have something that you don't like, do your research. I'm happy to see you. There are other good surgeons around too. This is not just an advertisement for me, but if you feel comfortable with me, please give me a call. I would love to help you. Some of the things that we spoke about are completely fixable. Some things are more challenging to be fixed, but everything requires a discussion and a specific consultation with your face. Good luck, guys. See you soon.